Parametric imaging offers us a three-dimensional kind of time-resolved ability to say how fast is the dye reaching a peak anywhere within the blood vessels. And so when we treat AVMs, often it's difficult for us to decide which of the entry routes into this vascular tumor is carrying the most robust blood supply and may offer us the best ability to first start shutting down the risk of rupture of this vascular tumor. Parametric imaging by color tells us where the blood's coming in at what rate, okay? And so that often helps gauge or give us an idea of how to stage or where to go after when we start treating these complex AVMs. From my standpoint, where I also see a huge opportunity with parametric imaging is stroke. Acute ischemic stroke can be very complex. There can be multiple occlusions at multiple sites. And often after we work for quite some time to open up a proximal occlusion, we sometimes lose sight of the fact that there are still distal blockages of significance. We feel a sense of relief that we've opened up the big, large vessel and feel that our work is done. Parametric highlights in a very obvious way the subtleties that could be missed with a typical diagnostic angiogram. We would see in parametric imaging a wedge of red color of distal blockage that then may allow us to change what we normally would do and go after those distal segments. I think there's a great deal of opportunity for parametric imaging around acute ischemic stroke. So the interpretation again for me is that the color coding makes it easier to read. Often, in another example, before and after a carotid stent. Before and after a carotid stent, it's crucial to make sure that the capillary blood supply to the brain is perfect throughout the whole hemisphere. And often for us to achieve that, we freeze the capillary phase and turn up the gain in the imaging to see whether or not there's full filling to the hemisphere of brain. Parametric imaging, in a very simple, color-coded way, would be able to tell me that there's significant delays, and it makes it a little bit more obvious than the gain capillary view. So for me, the color coding just simplifies the interpretation of the image.